A lot of people have been talking about this recently, but just wanted to reach out to you guys and highlight something that we've been talking about here at the medical center, and that is measles. So for those of you that don't know, measles is an upper respiratory infection. It is a virus. It causes a really high fever, so up to 105 degrees Fahrenheit, which is pretty high, especially in kids. Runny nose, cough, congestion. But the scary part about measles is that it can cause really severe complications in kids, including inflammation and infection in the brain. And that's why we worry about it. So it's pretty common to get an ear infection after measles or pneumonia and things like that. But the severe consequence of measles is the encephalitis, or the brain infection that can happen. About 2 to 3 kids out of 1,000 that get measles will get this very severe complication, and most of those will die from that. So we wanted to bring this to your attention and talk about it in more detail. The other thing that's important to know about measles is that historically, at least what we've seen in this country, is that measles is one of the most contagious viruses we've ever encountered. So over 90% of kids or people in general who are exposed to measles will get the infection or the full-blown disease from measles. So it's really important that we have a high level of vaccination in the community to protect people who might be at risk for getting measles. The measles vaccine is actually part of a combination vaccine called the MMR vaccine. So you're actually getting vaccinated against measles, mumps, and rubella when you get that vaccine. The first one that we usually give is right at 12 months old. So at the 1-year-old well child check, we get the first dose in, and then the second dose is routinely given right before kindergarten. So at that 4-year-old or 5-year-old visit before going to school. The first dose of the vaccine in people who respond to it is 93% effective, which sounds pretty good, but the second dose brings that up to over 97% effectiveness. So there's a percentage of people, somewhere between 5 and 8%, that don't respond to the first dose. So the second dose is really important, both to help increase how effective it is, but also to catch those people that didn't respond to the first dose. So 2 doses, one at 1-year-old and another one at 4 to 5-year-old. And then there's a variety of catch-up schedules if a kid or a patient in general hasn't gotten the full 2-dose series. One of the most common questions that we get is, doesn't it hurt, or what will happen if I get it or if I don't get it? So we've talked about measles a little bit, but the effects of the vaccine generally super safe, which is why we recommend it, unless you have a specific exemption or a reason why it might not be safe, which is why it's so important to talk with your provider, your primary care provider, about if it's right for you or your kids, so that we can individualize that to you. But the majority of kids who receive the vaccine might be sore in that spot where they got the vaccine. It's pretty common to have a temp around 100 degrees Fahrenheit the day that they get the vaccine, but that resolves, and most kids are their usual playful, happy baby selves the rest of the day and into the next day. So if you have questions specifically about your kid, please reach out, schedule an appointment. I'm happy to see anyone who has questions about that, as well as all of the other primary care providers here at the clinic. One of the other questions or concerns that parents or patients have had in the past is the link between vaccines and long-term consequences or long-term diseases in kids. And you may have seen or read about articles in the past that were published or made very popular, such as a possible link between autism or long-term learning disabilities from kids who receive vaccines. And I just want to be very clear that all of those studies have been completely negated, which means they've been debunked, or those are myths. We've got lots of evidence to support the contrary and to support how safe they are. This doesn't mean that there aren't kids that cannot receive vaccines. So it's super important, like we talked about, that you have that conversation with your provider so that we can answer those questions and make sure that it is safe for your kid to get this vaccine, and determine when the best time is for your kid to get their vaccines. Most of you out in the community may not have ever seen a case of measles, and that is because we very proudly in the US were excited to announce in 2000 that we had eliminated and eradicated measles from the United States. There are other countries as well that were able to successfully do that through the use of vaccines and disease prevention. And what that means is that there were no cases of measles that had originated in the US. So that doesn't mean that there weren't any cases at all. It's just that they were people who had traveled to the United States and happened to have measles when they got here. What we're seeing in the last few years is a slow and steady increase in measles, and this year there's been over 23 reported cases in the US, which is why it has been brought to our attention and something that we are highlighting now to try to get us back to where we were years ago and to get this out of our country again.